What's up, everyone? Dr. Eric Jackson here. It is that time of year. It's Halloween time. And so I thought I'd sit down briefly and give my thoughts on some Halloween tips, tricks, theory, dental theory, about how to keep your teeth as healthy and happy as possible, but also still enjoy this holiday. So let's talk about it here briefly. Let's split up the concepts into pre-Halloween, Halloween, and post-Halloween. Pre-Halloween, a couple ideas that you might like. Beware the Halloween candy bowl, right? The concept of going to the store, bringing back a bag or two of that wonderful mixed candy. Inevitably, either you're going to probably dump it into a bowl in preparation for the actual day, or you might maybe it's kind of early. Maybe you're just going to keep it in a bag. But those bags have a tendency to find their way open. And then every time you walk past that candy bowl or that open bag, you find yourself kind of grabbing one or two, and you do one in the morning or maybe after lunch, then maybe one after dinner. So you got, like a little candy in the lunchtime, little candy dinner. Maybe you're not gorging or whatnot. But the concept here is that we want to minimize exposure, the amount of potential damage, keeping it to a small window. So the time on the teeth is a concept that we're going to talk about a bunch here today. But snacking is something that it just prolongs the exposure of the teeth to the negatives. I've had many. I work with a lot of athletes. I've had many athletes, unfortunately, be kind of directed by coaches and athletic trainers and whatnot in the past, and they are getting better about it. But ultimately, we want to make sure that in the athletic world, we're not continuously bathing our teeth with Gatorade or whatnot, sports drinks. They are sugary. Get them in the stomach. That's where they're going to do the most good anyways. Get it down. Or if you're going to sip on something, sip on water. Rehydrate with your Gatorade and then sip on water. The same exact concept happens here with Halloween candy. Get it in your stomach. That's where you want it. Get it on the lips. Past the gums, look out stomach, here it comes, right? So the whole idea is that we want to get it off the mouth, out of the mouth, into the stomach. For number two, second section, Halloween, a couple ideas. The key here is that, I'm a parent, I've got 4 children. Trick-or-treating is fun. Trick-or-treating is a community event. It's great. I love it. I'm not one of the dentists that really kind of comes down hard on Halloween. I think you can do a little bit smarter Halloween. And that's kind of where we're going with this. So prior to Halloween, prior to trick-or-treating, see if you can get some food in your kids' stomachs. The idea here is that often kids will use candy as their dinner. They'll go out, as the sun is setting, and they're just going to fill that pillowcase or their bucket or whatever they use, and they're going to come back in and they're going to gorge, right? So if you could somehow get something nutritious and satisfying, something with a little bit of heft to it, to keep their stomach moderately full, they're not going to come back in and gorge their brains out on it. They'll still eat plenty, trust me. But with that said, they'll get their nutrition that they need for that day and then not overindulge. Along the same lines, try to get them hydrated. Give them some good water or some milk or whatnot prior to going out, because that'll play into the second thing I'm going to talk about here is saliva. So eating food produces saliva. The act of chewing, your brain recognizes that you're chewing. It starts increasing production from your salivary glands, and that's just a very good thing. Saliva is a very important aspect of your oral health. It often gets overlooked. It's very complex, by the way, and we're not going to discuss it all here. But some of the high points are that saliva lubricates the cheeks. Anybody who's had dry mouth knows how hard it is to just function, to talk. Your lips are sticking to your teeth. Your tongue feels like a desert. It's a very hard thing to do. Lack of mobility is very challenging from a speaking and functioning point of view. So it lubricates, it moistens, but it also pH balances. Saliva will take the acid produced by most bacteria and remove it, or I should say at least lessen it. By pH balancing the acids and bases, they'll be able to minimize that acidic production of the bacteria. In addition, it removes food particles, and it does so much. There's enzymatic action, so it helps digestion begins in the mouth with saliva. And so then it can continue down your throat and then continue in your stomach. So all these different concepts are very important, but saliva helps on so many different levels. And if you don't have it, it can't help. So eat yields increased saliva. Drink water, hydrate, yields increased saliva. Then your child can go out and tear it up on the streets, collecting with their pillowcase, come back in, and they've got a full stomach, they've got a hydrated body, and then they can go at it with hopefully minimizing all the different dental considerations. Let's talk about brushing afterwards. Of all the days to brush and to make sure your child brushes well, Halloween evening is definitely the day to do so. You do not want them to go after eating all this and they're snacking on the candy while they're trick-or-treating. It's hours and hours and whatnot. You don't want them to go to bed with their grooves of their molars filled with the candy and whatnot that they just consumed. Get in there. If you're going to brush it, if they're young, brush their teeth for them, and verify that all the grooves in those molars are out, are clean. All the food is out. If they're going to do their own brushing, perfectly fine. But I think that night would be a good night for spot checking. Spot checking is a very fine object. I spot checked my children after brushing them exclusively, their mother and I. Then we moved on to them brushing, but spot checking. And now my oldest two are able to brush their own teeth. But ultimately, I'm of the opinion that you really got to be careful, even until the age of 8. And some people might say, well, 8 years old, I'm not going to be, harping on them till 8. You don't have to brush their teeth for them, but it's a matter of maturity. It's a matter of understanding that not doing a great job every single time eventually ends up costing them enamel and then yielding cavities and whatnot. Kids just don't get that. And so at an age 8 is kind of my roundabout time where you can start kind of giving them some more leash, or a lot of leash if you wish, but really use caution until the age of 8. So full stomach, good saliva, good brushing, flossing, by the way. Kids normally don't floss at all. Unfortunately, lots of people don't floss much at all. But for children, they often have those spaces in between the teeth. You don't need to floss those, but beware of the final 2 teeth, those baby molars back there. Anything that touches should be flossed, especially on Halloween evening. You don't want stuff back there. But really, any tooth that's touching in a child's mouth, because not every kid has kind of that classic gapping smile, the kid smile. A lot of kids who might have some orthodontic crowding later on, they have a very adult smile, and all the teeth are in very adult positions, all without any gapping. Bring out the floss, get that together. You should be flossing those teeth. Any teeth that touches, you should be flossing it routinely, but especially on Halloween evening. So we've talked about pre-Halloween. We've talked about Halloween itself. Let's talk about post-Halloween. So you had an awesome time with friends and family, running around the streets and collecting just gobs of candy. What do you do with it all? So inevitably, my kids always yield. The take is huge. And there's way too much. We don't need all that candy. I always advocate kind of separation here. Pick your favorites. Make it, maybe mom and dad can select a vessel, a bowl or a bag, or even as just a Ziploc bag. Put your favorites in here, and then the leftovers can be dealt with separately. Because having obscene amounts of candy laying around kind of harkens back to our pre-Halloween. You don't want a candy dish sitting around there till Christmas, and you're always grabbing a little bit and a little bit and a little bit and a little bit, and your waistline and your teeth will suffer. So take your favorites, and what do you do with the leftovers? Well, you could dispose of them. You could throw them out. You could stick them in a drawer and save them for a different candy holiday, I suppose. But I always try to advocate, give them to somebody or donate them to somebody who doesn't have the opportunity to trick or treat the way that we all love and we all should cherish, frankly. Free to roam around at night is not something that is universally shared by everyone on this planet. So being free and being able to do what we want is something that I think take a moment to pause. That's one of the reasons why I've always done a candy drive for our troops. This year I've partnered with Operation Support Our Troops America. They are my kind of distribution arm, if you will. I've got a nice big candy collection. Today is our second day of collecting. We've already got a bunch of candy coming in for the troops. Operation Support Our Troops America is going to then take the candy from me. I'm going to get over there. They're a great local. I think they're over in Naperville. To bring it on over to them, just a small drive, and they're going to then distribute it out overseas to the men and women of the U.S. Armed Forces. This is exactly what I was kind of talking about a moment ago. You're stationed overseas. You don't have the opportunity to go house to house in your neighborhood, in your home. You're not with your family. There are so many reasons why a little fun-sized candy bar will boost that morale of that soldier, bring a smile to his or her face, and just really, really help. I love the stories that are shared by these groups that distribute all these care packages. And it's not just candy. Everything, all sorts of different care packages are sent over from volunteers and donations. So please check out, I'll put a link in the description below to the OSOT website. I'll also link again to the Candy Drive video that I made earlier last week. I think it's a really good summary of the event, but also of the concepts as well. You don't have to send it to the troops, however. There are other dentists that collect for, I know there's for local soup kitchens. I know churches collect candy to send overseas and to impoverished areas. I know that there are a lot of different options out there. Any organization that's collecting items often does a candy drive. So please consider your candy, your excess candy, to be donated to somebody else and just bring an absolute smile to their face. So hopefully these pre-Halloween, Halloween, and post-Halloween ideas have given you some thoughts to think about, some concepts to think about, and apply this Halloween season. I wish you all a very safe and happy Halloween. And again, as always, thank you for watching. A little bit longer video today, but I think these concepts are important to kind of flesh out instead of just listing. If you like the video, please give it a thumbs up. If you like the channel and the content, please subscribe. Make sure that you take a look at when you subscribe, there's a little bell. You click the bell, that way your phone or your laptop's going to get a notification whenever I update a new video. And then most importantly, leave any comments below. Ideas. I love ideas. What do you and your family do for Halloween to keep your teeth healthy? What kind of advice do you give your patients as far as when they're coming in this time of year? Did I miss something? What are some good ideas? Let's bring this all together and really just start creating this wonderful, nice community, sharing information, and everyone benefits from it. So thanks so much for your time. Thanks again for watching, and I'll see you in the next video. Bye-bye now.